House members still waiting for the green light this morning to return to work in D.C. Once they do get back, they will have a full range of priorities as the nation continues to struggle with COVID-19. Joining us now for our Connect to Congress is Congresswoman and Dr. Kim Schrier. She represents Washington's 8th District, which covers King and Pierce all the way to Kittitas and Chelan counties. Congresswoman Schrier, good morning, and thank you for joining us. The first question that so many people are grappling with is now the time for the country to reopen?
Look, different parts of the country are in different situations, but as a general rule, we are not ready. We still see that cases are increasing across the country. Certainly, if you take New York out of the equation, because we are seeing a decrease there, if you take New York out of the equation, we're still on the upswing. Not just that, we don't have enough testing to really have a sense of how many cases there are and what we're dealing with. And so until we have the data of who's infected, until we can test every person with symptoms and have the ability to locate their contacts, and even to do surveillance testing to see where hotspots are emerging, it's not time yet. And I'm sorry to say that, because I would love to see a return to some degree of normalcy. But I think that, if only 2 to 10% of Washingtonians have been infected, that means we're just as vulnerable as we were back in February.
And you just touched on it right there, that sense of normalcy. How long do you think it will take for the country as a whole to return to that feeling?
Well, look, I don't think we're really going to feel totally safe and return to total normal until everybody in this country has been vaccinated. And that's going to be at least a year away. So prepare for instead of an open, closed, on, off, prepare for kind of a dimmer switch where, according to what we see on the ground, test results, hotspots, we will have varying degrees of kind of opening and closing and normalcy. But we're going to have to be in this new, socially distanced, wearing masks, being very careful, protecting the most vulnerable for quite a while.
Let's talk about the government response here, where it's gone well and maybe where it hasn't as well. First, why don't we touch on some of the biggest successes by the government during this pandemic so far?
Well, I think it's great that our governors have stepped up across the country, listened to the science, and really communicated the severity of this. I also think it is great that we've taken a real jump on developing vaccines and testing treatments, that we're looking at the science and the research that's ultimately going to get us out of this. I think we have something like 30 vaccines being developed right here in the United States, 9 already in the second phase of testing, not to mention that across the globe, we have more vaccines in development, and that is critical. Things where we're lagging, really embarrassingly lagging, is that we still don't have anywhere close to the number of tests we need. Altogether, we've only done about somewhere between 150 and 200,000 tests here in the state of Washington. We're going to need to do 20 to 50,000 tests per day in Washington in order to really test, trace, and keep people safe.
You mentioned the testing there as maybe one of the failures thus far. Where else do you see where improvement could have happened?
I think the messaging is really important, that we have so many mixed messages coming out. I think it should be non-political people. And I know I'm a member of Congress. I get that. I'm also a doctor, though. I think it should be the scientists who are leading. I think that the CDC should have a bigger role. I think Fauci and Birx should be front and center, that we're getting very mixed messages in these briefings. On the one hand, saying that we're not safe, and on the other, a push to reopen. And I just think the American people are confused, and that this is something where we should all be on the same page. And it's unfortunately turning into just almost a political response. We're all in this together. We all want to stay safe. The American people need to feel that they are safe and can be healthy if they go out. We want to protect our loved ones. And so we really need consistent, straight talk messaging, whether it's good news or bad news. Just tell us where we are.
Let's talk about the fall. Let's fast forward a little bit here. What do you think should happen when it comes to reopening public schools?
I think opening schools is a really great question, and I think we're going to learn a lot with what we see from Italy. They're going from something very similar to what we're going through right now. They're starting to open schools, and we're going to see when kids are not in school, parents can't work, and as parents go back to work, what do we do with schools? When we go back, school would be different. I can imagine a scenario where we do a kind of a mix of what we're doing now with working at home, studying at home, and going to school. Maybe you break classes into, if it's a class of 30, then 10 kids go on Monday and Thursday, and 10 go on Tuesday and Friday, and 10 go Wednesday and Saturday, and touch base with the teacher and get their assignments, and then do the rest of the work at home, because we're going to need to socially distance. We're going to need to even stagger the times that kids go into school so there isn't crowding at the doors, and so there isn't crowding at recess and lunch. So we will have to reimagine this, because kids are very good at spreading viruses.
It'll be fascinating to see what that new configuration comes out to look like. Let's talk finances here real quick. How much further should the federal government go when it comes to financially assisting the individual states?
We need to pull out the stops. We need to do whatever we can to save the country at this point. States, cities, counties, they have to balance their budgets. I know this doesn't resonate well with the public. The federal government doesn't. We can borrow at 0 interest rate right now. But, if you want to support public education, you got to get money to the states. That is who really funds the vast majority of education. If you want emergency services, if you want your firefighters and your paramedics, you got to get money to the cities. These are the services that we all just take for granted, and we should not take things like water and sewer for granted. So big help to states, cities, and counties coming up in this next bill. I hope more assistance for people, and I hope more assistance at the same time for small businesses. And we're trying to reimagine a better system that could streamline assistance to people without having to go through banks. I think the PPP was an incredibly well-intended plan, but we're seeing some of the faults in it, and I think a lot of people are waiting for help and haven't gotten it. And so we are trying to devise a system that is fair and transparent and nobody feels left out.
In a worst case scenario, all these systems that we are putting in place now would be tested if there were to be a second wave, heaven forbid. If there is, do you think the nation is prepared for that?
We're not prepared. I don't know that second wave is really the word that I would use. I think we're going to have just a steady stream of this. There's no evidence that there is a seasonality. We've got outbreaks in Brazil, and it's pretty darn warm there. So I don't buy that there will be seasonality. I could be wrong. We're still learning about this virus, but I think we will have this simmering along. The problem that will happen in the fall is that once we hit the fall, all of our cold viruses come in. They cause coughs and fevers as well. The flu virus is going to come back. So please, people, get your flu vaccines. And every one of those people is going to be a possible COVID patient. So we're going to have to do even more testing in the fall, and that will really stretch our resources. I am really hoping that that the federal government, meaning the administration, will do everything in its power to do what the states can't do, to really direct manufacturing in this country to manufacture the swabs, the reagents, the media, the testing machines that we need. I'm working on a bill that I think will be introduced next week. Actually, it was already introduced. I think it will hopefully get into this bill to create a whole new national service corps that will do the public health work and the tracing and even kind of help manage the biggest vaccination program we've ever had in this country. So there's a lot of work to be done, and we need to do it quickly, including, of course, protective equipment for our healthcare workers and many other frontline workers.
Speaking of some things you're working on, you're now part of this bipartisan effort with Congresswoman McMorris-Rodgers to connect farmers with food banks. What would you like people to know about that?
Oh, well, first of all, I think it breaks all of our hearts that at the same time we have families, more families than ever, lined up around the block to get food assistance because people are hurting right now. We are hearing stories of farmers tilling under their crops because they don't have the markets. Our system is so tightly streamed that, you know, there's been a finely tuned machine that gets food to distributors, to restaurants and schools. And when schools and restaurants close, then there's nowhere for that food to go. It's not really designed to be destined to supermarkets. And so what this does, and I'm so excited to be doing this with Representative McMorris Rodgers, because we both have big agricultural communities, is to say, look, we want money to go straight to states. We want the states to be able to buy food from their farmers because they know where they are and they know where we can get that food. They know where the food banks are, sometimes just around the corner from a farm, and to really get that done in a fast, nimble way. There are great programs coming from the USDA, but they're still trying to figure out how to implement them. And families can't wait, and our farmers can't wait. And so this gives our states the ability to just pounce now.
All right, Congresswoman Schrier, thank you so much for your time this morning.
Thank you. Please stay healthy.
Thanks, you too.